Hematology is a branch of medicine that deals with the study of blood and blood-forming tissues, including the diagnosis and treatment of blood-related disorders. It includes the study of the composition, structure, function, and diseases of blood and its components, such as red blood cells, white blood cells, platelets, and plasma. Hematologists also focus on the diagnosis and treatment of blood-related disorders, such as anemia, bleeding disorders, blood cancers, and clotting disorders. Hematology is a critical area of medicine that plays an important role in diagnosing and treating many life-threatening diseases. There are many types of anemias, which are classified based on their underlying causes. Some of the most common types of anemias include hemolytic anemia, sickle cell anemia, thalassemia, aplastic anemia, vitamin deficiency anemia, iron deficiency anemia. Hemolytic anemia is a type of anemia that is caused by the destruction of red blood cells in the body at a rate that exceeds their production. The destruction of red blood cells, also known as hemolysis, can occur for various reasons, such as inherited genetic conditions, autoimmune disorders, infections, or exposure to certain medications or toxins. In hemolytic anemia, the bone marrow is unable to compensate for the destruction of red blood cells by producing enough new ones to replace them. This results in a shortage of red blood cells in the body, which can cause symptoms such as fatigue, weakness, pale skin, shortness of breath, and an enlarged spleen. The treatment for hemolytic anemia depends on the underlying cause, and may include medications, blood transfusions, or in severe cases, removal of the spleen. Hemolytic anemia can be a serious condition, and early diagnosis and treatment are important to prevent complications. Sickle cell anemia is an inherited blood disorder that affects the shape and function of red blood cells. It is caused by a mutation in the gene that produces hemoglobin, the protein that carries oxygen in the blood. This mutation causes hemoglobin to form abnormal molecules, which can cause red blood cells to become stiff and sickle-shaped, rather than the normal disc shape. Sickle-shaped red blood cells can get stuck in small blood vessels, leading to reduced blood flow and oxygen delivery to tissues and organs. This can cause a wide range of symptoms, including severe pain, fatigue, infections, delayed growth, and organ damage. Sickle cell anemia is a lifelong condition that requires ongoing medical care and management. Treatment may include medications to manage symptoms and prevent complications, such as pain relievers, antibiotics, and blood transfusions. Bone marrow or stem cell transplants may also be an option for some people with severe sickle cell anemia. Thalassemia is an inherited blood disorder that affects the production of hemoglobin, the protein in red blood cells that carries oxygen throughout the body. People with thalassemia have a genetic defect that causes a reduction in the production of one or more of the globin chains that make up hemoglobin. There are two main types of thalassemia, alpha thalassemia and beta thalassemia. Alpha thalassemia is caused by mutations in the genes that produce the alpha globin chain, while beta thalassemia is caused by mutations in the genes that produce the beta globin chain. Thalassemia can also be classified as either thalassemia minor, in which a person has one affected gene and usually has mild or no symptoms, or thalassemia major, in which a person has two affected genes and usually has severe symptoms. The symptoms of thalassemia can vary depending on the type and severity of the condition, but can include fatigue, weakness, pale skin, delayed growth, bone deformities, and an enlarged spleen. Treatment may include blood transfusions, medication to remove excess iron, and in severe cases, bone marrow or stem cell transplants. Aplastic anemia is a rare but serious blood disorder in which the bone marrow fails to produce enough new blood cells. It occurs when the stem cells in the bone marrow that are responsible for producing red blood cells, white blood cells, and platelets are damaged or destroyed. The exact cause of aplastic anemia is often unknown, but it can be caused by a variety of factors, including exposure to certain drugs or toxins, autoimmune disorders, and inherited genetic conditions. Symptoms of aplastic anemia can include fatigue, weakness, pale skin, frequent infections, and easy bruising or bleeding. The condition can be diagnosed through blood tests and a bone marrow biopsy. Treatment for aplastic anemia depends on the underlying cause and the severity of the condition, but may include medications to stimulate blood cell production, blood transfusions, and bone marrow or stem cell transplants. In some cases, immunosuppressive therapy may be used to suppress the immune system and prevent it from attacking the bone marrow. Vitamin deficiency anemia is a type of anemia that is caused by a deficiency of certain vitamins that are necessary for the production of red blood cells. The most common vitamins involved in vitamin deficiency anemia are vitamin B12, folate, also known as folic acid, and vitamin C. Vitamin B12 is needed for the production of healthy red blood cells and the maintenance of the nervous system. Folate is also important for red blood cell production, as well as for the growth and repair of tissues in the body. Vitamin C helps the body absorb iron, which is needed for the production of hemoglobin in red blood cells. Symptoms of vitamin deficiency anemia can include fatigue, weakness, shortness of breath, pale skin, and tingling or numbness in the hands and feet. Treatment for vitamin deficiency anemia typically involves taking supplements of the deficient vitamin, either in the form of oral supplements or injections. The most common causes of vitamin deficiency anemia include a diet that is low in the vitamins needed for red blood cell production, malabsorption syndromes that prevent the body from absorbing these vitamins, and certain medications or medical conditions that interfere with vitamin absorption or utilization. Iron deficiency anemia is a type of anemia that is caused by a lack of iron in the body. Iron is a mineral that is essential for the production of hemoglobin, the protein in red blood cells that carries oxygen throughout the body. When there is not enough iron available to produce hemoglobin, the body cannot produce enough red blood cells, leading to anemia. Symptoms of iron deficiency anemia can include fatigue, weakness, pale skin, shortness of breath, headache, dizziness, and cold hands and feet. Iron deficiency anemia can be diagnosed through blood tests that measure the levels of hemoglobin and iron in the blood. Iron deficiency anemia can be caused by a variety of factors, including a diet that is low in iron-rich foods, blood loss due to injury, menstruation, or gastrointestinal bleeding, and conditions that affect the body's ability to absorb or use iron, such as celiac disease or inflammatory bowel disease. Treatment for iron deficiency anemia typically involves taking iron supplements, either in the form of oral supplements or injections. In addition to iron supplements, treatment may also include addressing the underlying cause of the anemia, such as treating a bleeding ulcer or inflammatory bowel disease.